Good afternoon, everyone. My name is Dr. Paul Yeager, and I'm a professor and distinguished scholar teacher at the University of Maryland. And I'm also the co-founder and co-chair of Including Disability. This summit has been around for 10 years now, and we've offered both opening and closing keynotes from the beginning. Over that time, we have been grateful to feature many terrific keynote speakers. Some have already been accomplished leaders, such as the tireless advocate Jonathan Lazar or the utterly brilliant Ashley Shue. Others have been newer thinkers whose ideas that we felt more people should know, like Angel Love Miles and D.R.C. Neal. This is the first time, though, that a member of the team that works year-round to produce the summit and its companion journal has been one of the keynote speakers. Ron Padrón is both part of the Including Disability team and a thinker that many more people should have a chance to learn the ideas of. Ron has a master's in College Student Affairs and Higher Education Administration from Nova Southeastern University, and has also studied community ministry at Cherry Hill Seminary. In his regular job at the University of Maryland, he is the founding director of Opportunity, Access, Community Engagement and Support, or OASIS, at the College of Information, and co-chair of the President's Commission on LGBTQ+ issues for the university. His awards at the University of Maryland include the 2024 Pride in Advocacy Award and the Provost Do Good Innovator Award. At Including Disability, he is the Director of Academic Involvement for the Summit and Associate Editor of the journal. Recently, he's led the effort for the soon-to-be-published special issue on the implications of the 2024 election for disability. He's been published in outlets such as The Political Librarian, Disabled Faculty and Staff, and of course, Including Disability. Ron is, in short, an unwavering activist for LGBTQ+ and disability rights. But the way he thinks about these rights is very special, due in no small part to his emphasis on thinking of these issues in terms of interfaith approaches to social justice and collective liberation. In years of working closely with Ron, his unique insights have continually improved the summit, the journal, and our collaborative writings. These insights are the kinds of inspiration and fuel that we, the collective disabled, need right now to productively face down and pass through that tornado of grief and hope that I mentioned in the welcome 2 days ago. So it is a great honor to introduce you to the closing keynote speaker of the 2025 Disability Summit, Ron Padrón.
Thanks, Paul. Kind of glad I was off camera for that because I was blushing a lot. So thank you for that. And thank you everyone for being here. I hope you had a chance to enjoy the previous, 3 days of the summit. And yeah, so let's jump into it. What is the middle ground between a curb cut and eugenics? So 4,000 years ago, a young man was buried in what is now Vietnam. His burial is different from others at that site, however. He was lying on his side in the fetal position. When archaeologists investigated further, they found that his vertebrae were fused and several bones were crippled by disease. It's likely this man suffered from something similar to the congenital disease Klippel-Feil syndrome, resulting in limited or no use of his arms and paralysis below the waist before he hit adolescence. What this burial also showed, however, is that he lived at least another 10 years being supported by his community. I want you to know that the story of this millennia-old burial is not unique. There are dozens of other similar sites around the world showing individuals with disabilities so severe that the only way they could have survived to any advanced age was through the care and support of their community. I want you to consider this story juxtaposed with the world's richest man openly proclaiming that empathy is a weakness and the downfall of civilization. When I was asked to provide the closing keynote address for the 2025 Including Disability Global Summit, I spent some time thinking about what I would want to accomplish with this platform, and I landed on 3 goals. 1, I wanted to provide historic examples of how community care and support has been the foundation for our survival and resistance. 2, I wanted to highlight ways we can rebuild and reinforce our communities now in order to survive this particular historic moment of rising authoritarianism and far-right nationalism. And 3, I wanted to use as many of the words banned by the second Trump administration as possible. To that 3rd point, you should have received a banned word bingo card via email. If you didn't get it via email, it should be getting dropped in the chat now. And I invite you to play along during the course of this address if you'd like a chance to win a free IDGS t-shirt. You can either if you maybe printed it out, you could download it, however you want to access it. But when you completely fill in your bingo card, so not just a line in one direction or the other, when you completely fill it in, you can email it to includingdisabilityjournal@gmail.com. We'll accept the bingo card submissions until tomorrow, Friday, April 25th at 5 p.m. Eastern, at which point I'll use a random number generator to select 5 people to win a t-shirt of their choice from the IDGS merch site. I'm not saying everyone should pick the cow shirt, but that one is my favorite. So let's get to it. We can't talk about the title of this talk without first discussing what many refer to as the fallacy of the middle, or an argument to moderation. Many of you have likely seen some version of a political cartoon, like 2 that are being shown on the screen now, that I believe best encompasses the surreal absurdity and the real danger when the fallacy of the middle meets the abandoning of our collective power to those in positions of leadership. The comic generally starts with 2 figures standing apart from each other, facing one another. One figure says to the other, "Meet me in the middle," and the other figure complies. As it does so, the first figure takes a step back. The process repeats itself for several panels, one figure demanding the other meet in the middle while stepping back, the other figure acquiescing and stepping forward. By the end, both figures have shifted well beyond the original middle ground and are firmly on one side of the spectrum represented in the comic, or represented in the comic on the far right, just completely hurtling over the edge. There are several instances where this logical fallacy can apply, but for purposes of today, I want to focus on the interplay between the struggle for disability rights, or frankly, any marginalized community struggle for liberation and equality, and politics. The basic premise of any multi-party system is that various parties represent some collection of views or opinions on any given issue. These parties are then represented in the various institutions of power that make or enforce laws. The fallacy of the middle, as applied to this sort of political system, makes several assumptions. First, it assumes that any issue can be reduced down to a binary choice. Second, it assumes that within that binary choice, all possibilities exist across a spectrum with extremes at either end. And third, it allows for an argument to be made that the best choice for any given scenario rests in the middle of these 2 extremes just because it is in the middle. Think centrist, or fair and balanced, or both sides. It should also be noted that this fallacy assumes one side of the ideological spectrum won't just buy an election or attempt a coup in order to implement an authoritarian fever dream. Middles and fallacies be damned. We also need to address one of the uniquely sinister aspects of American neoliberalism since at least the mid-20th century: the pivot towards a toxic, hyper-individualistic sense of self as the epitome of a real American. This mindset, sold to us at every turn, has vilified the idea of community care and support. It is the modern face of the long-running belief that to ask for help is to communicate weakness, that real Americans don't need handouts, a belief that demands that the bootless pull themselves up by non-existent bootstraps. This fear of appearing weak by relying on community is animated by the same spirit that birthed the moral model of disability. For those who may be unfamiliar, the moral model of disability is one that stigmatizes disability as a manifestation of wrongdoing, sin, or poor moral character. It contributes to the social exclusion of disabled people by marking them as either something to be pitied, avoided, or erased. You see echoes of this in how we discuss things like poverty as a personal failing or a punishment someone deserves because of their choices, instead of something often well beyond an individual's control and a result of particular systems or policy decisions. While some may describe the moral model of disability as outdated or obsolete, I ask you to consider how invisible disabilities, including mental health, are treated in our modern society. How many people, maybe some of you, think twice before disclosing a disability for fear of how your peers might change how they view you, out of worry that your employer may decide you are less productive? How many of you push yourself well past your limits in order to mask as abled so you don't draw attention to yourself, or so you don't feel guilty about not doing as much as those around you? This same cultural narrative that shames us into silent suffering and painful isolation, that hamstrings our ability to acknowledge our limitations and build collectively, also makes us reliant on change being initiated from the top. We rely on those in power to make decisions about circumstances they likely have never had to experience and have no real knowledge of. And, most ironically, we rely on them to willingly make decisions that might constrain the power that they do have. In my own spiritual practice, I often look to our shared ancestors that helped to shape the world that we live in now. The radicals, the poets, the dreamers, the mothers, and the fighters, for guidance and for strength. It helps me to recognize that ours is a shared struggle, that my fight is their fight. In a quote often but likely inaccurately attributed to Mark Twain, history doesn't repeat itself, but it often rhymes. Learning their stories, understanding our shared history, can inform how we resist the forces that seek to erase us today. This, in my opinion, is why so much energy is placed on erasing access to our own stories and community wisdom. This is also why I can't separate the first two goals of this talk. I can't talk about ways we support and reinforce our communities without pointing to the work that has been done before as inspiration and example. For the remainder of this talk, I will be discussing what I believe to be crucial ways we should all be engaging in resistance and rebellion in these increasingly dismal times. First off, telling our own stories. So personally, I have a soft spot for zines, so that's immediately what I went to for this. So I need to mention three in particular: the Disability Rag, Coalition, and Mouth. The Disability Rag was a disabled magazine that began in Louisville, Kentucky, and was published from 1980 to 2004 in a print version and existed in an online version until 2007. It was founded by Kaz Irvin, a polio survivor who was looking for ways to connect disabled people, and Mary Johnson, a non-disabled person who was active in disability rights organizing. Its first issue was a bifold printed at a quick print shop that included information on local disability activism, as well as first-person accounts of, quote, living like a refugee as a person with a disability. It quickly grew into a national outlet for the disability rights movement, highlighting the needs of this underrepresented group. Coalition was a magazine published by the Greater Manchester Coalition of Disabled People. It began as a publication, as a news sheet in the mid-1980s, and grew to a larger magazine featuring articles by disabled writers and activists, both UK-based and internationally. And they often reprinted articles from the US-based disability magazine, Mouth. Mouth began publication in 1990, and throughout its life, it was a print-only publication. The ethos behind this publication was intentional provocation and disruption of the, quote, do-gooder approach to disability rights. Nothing, I believe, explains Mouth better than their own explainer for the name of the magazine. So to quote them, Mouth brings the conversation down to street level, where well-intentioned special programs wreak havoc in the lives of ordinary people. People talk about calling a spade. We call Jack Kevorkian a serial killer. And when maggots outnumber nurses' aides at what others call a care facility, we call it a hellhole. We say it out loud. If special education is so darn special, every kid in every school ought to have the benefit of it. Ask the next do-gooder you meet, have you checked yourself into a nursing home lately? Tried to board an accessible bus in a wheelchair? Filed an ADA complaint with the US Department of Justice? ask a charity for actual help? The answer will likely be no. It's not in their job description to use the godforsaken things. And so it is that do-gooders go on doing their work about us, without us. And along comes Mouth, roaring up from the street level to take their system by the throat. This rude little magazine demands answers from the people in charge, laughs at the lying answers, and occasionally bites down, hard, somewhere near the throbbing jugular. Sadly, Mouth and the voice that issued forth from its unapologetic maw went silent in 2009. Too often, the disabled community is talked about as research subjects, as victims, as stereotypes, as a political football. In some instances, we may be spoken to, asked to be a representative for an underrepresented population, provide a quote for an op-ed, or co-sign onto a diversity initiative. Less frequently are we listened to. No one knows our stories better than we do, and it is up to us to tell them. We are living in an era of increasing censorship and paywalls, where casual cruelty in comment sections or forums makes it easy to deny the humanity of others. Telling our own stories as disabled people allows us to be seen as more than just a statistic and shatters the silence about the realities of our existence. For example, as a queer person, when I talk about my marriage, when I talk about marriage equality, folks assume I'm discussing Obergefell and the renewed threat to my own marriage. Very few know what is referred to as the marriage penalty for disabled people that can result in a loss of Social Security benefits of up to 25%. Why is that? If your immediate answer is that no one wants to write about it or no one wants to give a platform to disabled people to talk about this, I want you to challenge that thought. We don't need permission to speak. Whether it's blog posts, letters to the editor, TikTok, or open mic nights, the tools we need are right in front of us. We're no longer restricted to quick print shops in order to once again open our collective mouth to demand answers, laugh at the lies, and occasionally bite down hard. Now we'll talk about building local community for direct action. So Delta Sigma Omicron, DSO, is a co-ed fraternity and an early force in the disability rights movement. It was founded by disabled students, a large number of them were World War II veterans, at the University of Illinois in 1949. In addition to the fraternity, the students also founded two publications, a student newspaper called The Spokesman and an annual publication called Sigma Signs. The students who established this fraternity were part of the university's nationally recognized Rehabilitation Education Services program. They engaged in advocacy and activism on campus, conducting assessments of classrooms and dorms, and mapped out where curb ramps were necessary to increase accessibility. When told that curb ramps would only be added when construction was necessary, the members of DSO began late-night campaigns of taking sledgehammers to sidewalks to force the university to rebuild the sidewalks, meeting the necessary criteria to have the ramps installed. For legal reasons, I am explicitly saying that I am not advocating for property destruction. I just want to make that clear. Their advocacy also extended off campus, forging relationships with disabled folks in the broader community. And as DSO students graduated, they began to form a network of disabled activists fighting for change at the state and federal levels. You've probably seen or heard this quote on social media, quote, "No one is coming to save us." This is a common refrain when someone that has been held up as the main character of our current young adult dystopian fiction novel / movie once again fails to live up to our expectations in a stunning third act climax that topples the empire and fades to "and they live happily ever after." Despite its potential overuse, the sentiment is correct, especially for marginalized communities. Every system in the history of humanity to this point has been designed for the benefit of a specific class of people. Who that class is depends on place and time. The United States was designed around the interests of wealthy white men. While over time the Constitution was amended to theoretically extend recognition to more communities, the foundation that was laid in our institutions 250 years ago is built on a specific idea of power and access. This is the headwind that marginalized communities have been marching into since the very beginning of this country. When we say no one is coming to save us, what we mean is that systems that were not designed for us at best, or were designed to exclude us at worst, are not suddenly going to morph on their own. This slogan speaks to the heart of resistance and survival that underrepresented communities throughout history have known. We survive by building the communities that will keep us safe and set us free. This is what the students of DSO did. Individually, they all had limited capacity to navigate the societal and institutional policies and restrictions that prevented them from equal access to education. When they came together as an organization, as a community with shared experiences and a common goal, they were able to enact radical transformation on a local scale. The sledgehammer probably helped too. Over time, through a broadening of their network, through students graduating and taking their experience and knowledge to a new location, what began as a local movement was able to grow into something much larger. This is one of the key benefits of focusing on local community. Not only can you often affect change much more quickly, it can also serve as a sandbox to gain valuable organizing and mutual aid experience that can translate into more effective, sustainable, larger movements. I also want to talk about building intersectional coalitions of community. Brad Lomax was an American civil rights and disability activist and helped to create the Washington, D.C. chapter of the Black Panther Party. In the late 1960s, he decided not to join the military due to the racism experienced by Black soldiers during the Vietnam War. And instead, he enrolled at Howard University. It was around this time that he began to exhibit symptoms of multiple sclerosis, which required the use of a wheelchair. His experiences as a wheelchair user, namely the lack of accessibility to public spaces and accommodations, shaped his advocacy for Black liberation. For example, once in Oakland, California, he helped to establish a chapter of the Center for Independent Living in collaboration with the Black Panthers. His role as a bridge between two groups, both advocating for civil rights, serves as a model for what coalition building can and should look like. And I feel like this is really, really made manifest in the movements that came after the passage of the Rehabilitation Act of 1973. So despite passage of that, the disabled community continued to face substantial obstacles in accessing spaces and services. Unclear definitions in the Act allowed for lax enforcement of what few protections it did provide. After years of waiting for additional support and guidance, disabled activists began to stage sit-ins at federal buildings around the country. In San Francisco, the site of one of the largest sit-ins, Lomax recruited the Black Panthers to provide food and other resources to the protesters. Through the work of Brad Lomax and other coalition builders, such as Judy Heumann and Kit Cone, the Section 504 sit-in at the United Nations Plaza in San Francisco managed to last 26 days. This would likely not have been possible if it weren't for the web of relationships that had been cultivated. Groups that were enlisted to support this movement, beyond just the Black Panthers and the American Coalition of Citizens with Disabilities, included Glide Memorial Church, the Gay Men's Butterfly Brigade, Delancey Street, United Farm Workers, and the Salvation Army. If there's one thing I hope you take from my talk today, I hope it's this. There is no way through this without community. I spoke at the beginning about the toxic notion of hyper-individualism, the idea that we all somehow navigate this society as separate entities. This siloed approach to existence only serves to weaken us. We see this mindset playing out in our larger sociocultural discourse as well. We seem incapable of discussing more than one issue at a time. Disability justice, income inequality, genocide, authoritarianism, racism, as if all of these issues are not interconnected. Cultural conditioning and, in my opinion, the fracturing of the internet and rise of social media have fitted us with blinders that keep us from realizing the very real power that we hold. And we can only recognize that power collectively. We can only wield that power when we acknowledge someone else's struggle for freedom and equality is also our struggle for freedom and equality, even if the face of it looks different. Oppression of any group is a training ground for the oppression of all groups. You may not be disabled, but the ability to restrict the earning potential of someone based solely on their perceived productive capacity or lack thereof creates an infrastructure that can and will swallow up other groups. It's also important to remember As long as we leave ourselves disconnected, isolated, and self-interested, we are fighting harder and not smarter. Turning back to the Section 504 sit-in example, the activists who occupied the building on United Nations Plaza were only able to last as long as they did because of the support they received from groups that recognize the interconnectedness of their struggle. I previously mentioned that the Black Panthers provided meals as part of their food programs, but the Salvation Army provided mattresses and blankets. City workers who were supporters of the disabled activists brought portable showers, and various labor unions from around the country provided moral and emotional support by writing letters. So I want to also talk about acknowledging the realities of grief and loss. I acknowledge what I'm about to talk about could potentially be triggering for folks. So if you need to step away for a while, that's totally fine. But I very much feel that it's important to specifically acknowledge the histories and legacies of grief, loss, trauma, and death in our communities. And the example I chose to highlight that is that of Ruth Coker Burks. So Ruth Coker Burks is an example, just one example of the countless women who showed up for the LGBTQ plus community in the 1980s, when folks were being abandoned by both the healthcare system and their own families during the AIDS crisis. In 1984, while visiting a friend who was receiving treatment for cancer, Burks noticed that hospital staff were unwilling to enter a particular room. And she learned that the man in that room was an AIDS patient. Burks spoke with the man in that room, and he shared that he wanted to see his mother before he died. So Burks reached out to his mother, but she refused to see him, to see her son, and refused to claim his body once he passed. And that man died 13 hours later. During his final hours, Burks stayed by his side and took over his palliative care. When he died, she tried to find a funeral home that would bury him, but was repeatedly turned away. She was eventually able to have him cremated, and she buried his ashes in Files Cemetery in Hot Springs, Arkansas, where her family owned several plots. Following this, Burks began receiving calls from hospitals and AIDS patients. She would help take patients to their medical appointments, coordinated with local gay bars and drag performers to fundraise for medication and arranged funerals. While the numbers are disputed, several AIDS patients were buried in plots she owned after having been abandoned by their own families. Notably, the patients that she cared for lived an average of 2 years longer than the expected lifespan of someone diagnosed with AIDS at that time. And this prompted the Centers for Disease Control and Prevention and the National Institutes of Health to actually research her methods of care. Western culture has an unhealthy relationship with grief, loss, and trauma. We don't want to talk about it. We don't want to acknowledge that it occurred, let alone our culpability in it. While the example I chose to highlight is from the AIDS outbreak in the 1980s, we're all currently living it with the current approach to COVID, even though the official consensus is that it's over. One of the metrics used during the early years of COVID was comparing the number of pandemic-related deaths to the number of lives lost in war as a way to provide a sense of scale. And there's been considerable debate over whether it's appropriate to compare these two things. And my point here is not to compare someone buried in Flanders Field to any of the COVID victims stored in refrigerated trucks, but how we weigh the value of a death is a philosophical quagmire for another time. What I want to draw attention to is what we choose to acknowledge and whose deaths are worthy of memorializing. Death, loss, and grieving are often co-opted as tools in a narrative of national identity. At scale, this narrative is controlled by those in positions of power and are often used to perpetuate a particular type of cultural propaganda. When we remember and honor our heroes, but never our victims. We rewrite mass death as unavoidable and unfortunate, and not the consequences of specific policy choices or strategic inaction. The history of any marginalized community, whether disabled, LGBTQ+, Black, Latinx, Indigenous, is a history of death, loss, and grief. It is also a history of burying these truths as deeply as we can. demanding that entire populations just get over it and move on. Our role in resistance is to serve as cultural necromancers, summoning forth from the shadows the specters of those whose voices have been silenced and whose scars we collectively carry. We summon the countless dead lost to the twisted history of asylums. We call forth the voices silenced by the near century of ugly laws in America. When we wield this power, we join our voice with millions of other disabled voices lost through neglect, malice, and inaction. This is a powerful force that wields grief and loss as a disruptive force that upsets propriety and corners a culture of avoidance, demanding it finally acknowledge the blood on its hands. To be forced to acknowledge the pain of loss is powerful and transformative. Emmett Till's mother understood that. Pedro Zamora understood that. But we still need to create space for joy and for dreaming new worlds. And for that, I want to talk about Camp Jened. Camp Jened was a summer camp established in 1951, located at Hunter Mountain in the Catskill Mountains in New York. It was a camp designed for disabled children, teens, and adults. There are many amazing things that can be said about the camp, and you can watch Crip Camp if you want to dive more deeply into it. But I want to focus on two things in particular. First, the camp was a vibrantly social place. There was minimal adult supervision, and campers were allowed to just be themselves. Being in community with other disabled peers allowed campers to have conversations they couldn't otherwise have. Several former campers described it as a utopia, where they could escape the social isolation and shame they experienced at home and just live their lives, having typical camp experiences ranging from smoking pot to hooking up. Second, Camp Jened allowed campers to dream of a different way of being. To quote Judy Heumann, who herself was a former camp counselor, "At Camp Jened, we were able to envision a world that didn't have to be set up in a way that excluded us. We started to have a common vision and were beginning to talk about things like, why are buses not accessible?" It should not be a surprise that many of these campers would go on to become influential disability activists. Fascism wants you tired and afraid and miserable. It wants you exhausted, unable to conceive of a future in which it does not exert total control, so that you give up and obey in advance. Camp Jened provides a perfect example of some of the most effective and dangerous ways of resisting systems of oppression: joy and dreaming. And yes, I said dangerous. If joy wasn't so dangerous, the people in charge wouldn't be spending so much time and effort to deny your ability to access it. And dreaming allows us to envision a world better than the one we're currently being offered. Joy is best shared in community. It nourishes and sustains us in dark times. It plants seeds of possibility in those around us and lives on as treasured memories we can turn to when things seem to be at their worst. The more we share our joy, the more we collectively build a perpetual motion machine of hope. Joy is also the fuel for dreaming. It's hard to imagine a better future when you're miserable. Joy provides us the mental, emotional, and spiritual space to think, how can I make this feeling last? How can I help others to feel this way too? And it is in that space where we can see the world not as it is, but as it could be. And when you start to dream of a better world, you start to notice all the little places that dream is trying to break through. Maybe it's the mutual aid group in your town, or the disabled poet whose work you just stumbled across. Whatever it is, it calls to you, demanding you help bring it further into being. And along the way, you encounter more and more people whose dreams align with yours. And before you know it, you're a movement, helping to redefine what is possible as a disabled person in this new world. So I want to return to the title of this talk: what is the middle ground between a curb cut and eugenics? You may be wondering how a discussion of the fallacy of the middle, a historical retrospective, and the lessons we can learn from those who came before us provide an answer to this question. And the answer is it doesn't, they don't. Instead, I hope this prompts you to ask, why does this question exist to begin with? Who gets to frame the context in which this question exists? The basic premise of this question starts from a place where we have voluntarily ceded our collective power to those at the top of our existing systems and institutions. On one side of the question, we're platforming those we know wish disabled people just outright didn't exist, who see us as drains on society, or more accurately, drains on their wealth. The question provides rooms for policies of eugenics when, in truth, that position should be unequivocally barred from the conversation. And on the other side, we've placed things like curb cuts as the goal, as the ceiling of accessibility, when we should be challenging ourselves to dream of ways to make the world even more accessible. The history of the disabled community is full of technologies, spaces, and ways of being that exist despite us being told no, despite us being told they were impossible, despite the well-meaning paternalism of those around us telling us not to have big dreams. While working on the final bits of this address, a friend shared an article about yet another round of federal layoffs at the Centers for Disease Control and Prevention. As a result of these layoffs, more than 40% of the scientists and workers at the National Center on Birth Defects and Developmental Disabilities were put on administrative leave, which is just the sanitized way of saying that they were fired. These cuts resulted in the elimination of the Division of Blood Disorders and Public Health Genomics and the Disability and Health Promotion branch of the Division of Human Development and Disability. Also impacted was work with the National Syndromic Surveillance Program Disability Data, which helps to detect public health outbreaks impacting disabled people. The research and programs conducted by those who were unceremoniously fired via email at the beginning of April, quite literally to help improve health outcomes and extend the lifespans of disabled people. There is no other way to construe this as other than an outright abandonment of disabled people by their government. But we can resist this and overcome it, because we, and others cast to the margin, have done so before. We can tell our own stories, in our own voices, about the very real and immediate impacts this decision will have on us and our communities. And if no one will hand us the mic, nothing is stopping us from starting a blog, or making photocopies of your own zine at the local library and leaving them at bus stops, restaurants, or your local record store. If those at the top won't listen, we start at the street level and come roaring up. We build local community to support our most vulnerable and to share emerging and accurate information, and to advocate for continued investment in resources for the disabled. We ensure those communities are intersectional. We realize that the fight for public health and environmental justice to prevent Black and Latinx communities from becoming dumping grounds for industrial waste, and the fight to ensure accessible classrooms and education, and the fight against voter disenfranchisement are all part of the same movement towards a more just and equitable world. We acknowledge that these cuts will result in harm and death, and we don't run from that fact. We don't sanitize this reality to make our struggle more palatable for others. We don't play into respectability politics, and we allow ourselves to grieve openly as a community. We refuse to let our dead be forgotten. And we continue to celebrate and make time for joy. Maybe it's a birthday, or a wedding, or a great book, or an absolutely amazing meal. But most importantly, we dream. We dream of something new to replace what was taken from us, something better and more just. And we work to make it a reality. I want to end this talk with a quote from Egyptian pro-democracy activist Wael Ghonim. The power of the people is much stronger than the people in power. I hope you remember this, and I hope you can look back on our shared history and see how we have lived this. I hope you never cede your power to others and let them set the parameters of the question. Thank you for your time and attention, and thank you once again to the Including Disability Global Summit for this opportunity.
Thank you, Ron. That was absolutely spectacular. We we could not have given that closing keynote to anyone more deserving or more wonderful at it. And he's one of ours. Could you imagine?